I'm Dymian Kritikos with Titronics. We're here in West Liberty, Iowa. We're here with Dr. Carl Gilman in his office. And Dr. Gilman, how long have you been in practice?
I graduated Palmer in 1997.
Okay. And how long have you been using the Titronics C3000?
C3000 about a year, a little over a year.
Okay. And typically when you have patients come in, you'll scan them each time?
Mm-hmm.
Okay.
Absolutely.
And as new patients, you're doing the scans yourself?
That's right. New patients I scan initially, yes.
Okay. Mm-hmm. And what's the typical process? This is the first step in the regimen?
Correct. When the patient arrives in the office, they'll sign in and they'll come right back here to the adjusting room. This is the first place that they stop. And we'll set them in the chair, we'll run the instrumentation scans, and then from that point, after we've gathered that information, then we move them over to the tables.
Right, okay. Mm-hmm. And as far as educating the patient, helping them understand a subluxation and what the process involves, how does the display and the graphs on the screen help them understand that?
Well, the line graphs are important for me, and basically the bar graphs are what the patients really interact with. And it's because most of us are visual, and so we can actually display the bar graphs on there, and they can see visually whether or not they've got areas of interference.
Okay. And you had mentioned sometimes you even have the young ones, the children, seem to understand some of those graphs.
Yeah, the children actually understand it much faster than the adults do. And they'll look at it and they can see by the different colors that are displayed on the bar graph, they'll look for how many areas may have red or yellow, and they're always looking to see how green they are. They want to make sure that they're good and green.
Versus red.
Versus red.
On the screen.
And they pick that up right away.
Sure. Do you see that if a patient is coming in and they're perhaps new to chiropractic, does it help them understand the process, the chiropractic process?
Yes. Initially, when they're typically highly symptomatic, they can correlate areas that may not be feeling very well to the colors that we display on the bar graph. And that would be for either just a cervical scan or even a full spine scan. People can correlate exactly the areas that may show up as yellow or red or orange versus areas that are green and where their symptoms are. Later, after care has continued for a period of time, they'll actually start seeing on visits where they may not be feeling all that symptomatic, we can still display that day's scan as having areas that may be showing interference that they don't have symptoms for. So it's very important that way.
Right. And you had mentioned earlier, in terms of the scans themselves, that has been stored in the system for some time. Perhaps they haven't been in care for a while and now they become symptomatic. Did you say that when they come back in, now you're able to scan them and lo and behold, their pattern comes up again?
Absolutely right. There are a lot of patients will come in for symptomatic relief, and they'll discontinue care for a period of time once that has been achieved. So by storing the information in the computer, when they reactivate as a patient, they come back because those areas that were symptomatic before are symptomatic again, or perhaps new areas. We can actually show them a direct correlation from the previous scans to the current scans.
Right.
Absolutely.
That's great. So it shows them that pattern will exist for a long period of time. Sure. And you had mentioned as far as patients scanning, were you able to actually do some other things and perhaps have an assistant do some of the scans? Could you explain a little bit about how that flow works?
Absolutely. On the higher volume times in the schedule, my office manager will come back and she will actually do scans for me and place patients on the table, get patients up from resting to get them back over here to get a post check. So I can be actually working with the patient, and all it takes is a glance at the computer screen for perhaps the next patient that's going to be placed on the next table, where I can see actually where they are in reference to their stored pattern.
So you're able to see that just at a glance and actually mark the chart and
when the patient comes over on the table, I'll get the chart, I mark it as to what I've seen on the screen. It's very, very fast.
Great. Okay. And at this point, if you would give us a demonstration and show us exactly how the scan works and how you tend to do that.
Absolutely.
Thank you.
The scanning procedure is really quite simple. The patient is seated in the chair, and this is a patient passive test. So the patient is asked to remain still without their legs crossed, and we just roll the instrument right up neck. We're doing a cervical scan only in this instance. And we'll click on the fossa test. And then the other side. So now we can see that she's, as far as the fossa is concerned, she's warm on the left. It's also got the needle at the top, which is evocative of the neurokilometers. So you can either look at the bar graph information, the printed, or the needle swaying up at the top. And as I said before, this is important for us as clinicians to track patients. But the patient actually responds better to this display. They can understand this a lot easier. It's much easier to comprehend for them. People, by and large, are very visual, and so this is extremely helpful. And if you're doubting whether or not people are visual, just go home and look in your living room to see how much of your furniture is aimed towards the television. But people will pick up on this quite well and quite easily. It's very simple to understand, and you can start off with fairly simple language in order to get them to the point where perhaps in the future they'll understand this a little bit better and how it correlates. But this is a very great tool here. As I said before, the kids pick up on this almost immediately. Once everything is stored in the system, we can also use the printer to print out certain graphic representations on paper. This is a generic comparison. You know, we would typically hand that to the patient. It gives an explanation of thermography and so forth.